For decades, many people have been told that after 60, the body becomes too fragile to change, and that intimate well-being fades inevitably with time. The truth is that your body at any age is responsive, adaptable, and ready to improve when you give it the right kind of gentle stimulus. Today I'm Dr. Susan Parker, here as your guide in mature wellness, and I'm going to walk you through a simple, respectful, and non-invasive technique focused on the perineal point, an external pressure routine you can do over clothing that takes 40 seconds and can help your circulation, pelvic comfort, posture, and confidence in daily life. This is not a medical diagnosis or a substitute for clinical care. It's a practical routine you can test safely, adapt to your needs, and discuss with your trusted health professional if you have questions. The aim is clarity and calm. 1 point, 40 seconds, steady breathing, and a noticeable shift toward ease. Before we begin, let's set the scene so your body feels supported. Choose a quiet space, sit on a firm chair with a straight back, and place your feet flat on the floor about hip-width apart. Keep your shoulders relaxed, your jaw soft, and let your hands rest on your thighs. If you tend to get cold, have a light blanket for your knees or a warm compress for your lower abdomen. Warmth encourages blood flow and helps tissues soften. If you've been sitting for a long time, stand up for 30 seconds first, march gently in place, and then sit again. A hint of movement wakes up the legs and prepares your pelvic floor for a friendly nudge rather than a surprise. The entire routine will take just a few minutes, and most of that is breathing. Now let's define the point without using explicit language. The perineal area is the soft diamond-shaped region at the base of your pelvis, between the bony seat you feel under each side of your hips when you sit up tall. Imagine the center of that diamond. That center is where we aim the pressure. We will not press directly on sensitive structures. Instead, we'll use broad, gentle, evenly distributed contact across clothing so the tissue receives a calm signal to relax. Your tools are simple: your breath, your posture, and either your hand, a small folded towel, or a very soft ball no bigger than a small plum. No oils are needed. Clothing provides the right amount of friction control and privacy. If you prefer not to use your hand, the folded towel method works beautifully. Here is the 40-second routine in clear steps. First, align your posture. Sit tall, as if a string gently lifted the crown of your head. Tip your pelvis slightly forward, so your weight rests on both sit bones evenly, and unlock your knees. Second, place the folded towel on the chair, so that when you sit, its thicker part is under the center of your pelvic base. You should feel broad contact, not a sharp point. If it feels pokey, add another fold. If it feels absent, unfold a little. Third, place your hands on your lower belly and take 3 slow breaths in through the nose and out through the mouth. Fourth, begin the 40-second press. Lean your weight very slightly forward so the center of your pelvic base rests more fully on the towel, and imagine the tissue softening under warmth. This is not a push. It's a melted butter kind of settling. Hold that gentle pressure while breathing slowly for 40 seconds. Fifth, release the pressure gradually, sit back, and notice sensations, warmth, a sense of space, or a subtle drop in tension. Sixth, take 3 more breaths and stand up slowly to feel the difference in your hips and lower back. How much pressure is appropriate? Use a simple comfort scale from 0 to 10, where 0 is no pressure and 10 is painful. Stay between a 3 and a 4. Definite contact, clearly felt, but comfortable enough to sustain the full 40 seconds without bracing the jaw or holding the breath. If your face tightens or your shoulders creep upward, that's your body telling you to reduce the load. The sign you're in the right range is that your breath remains smooth and your belly can expand gently on the inhale. Another sign is warmth spreading across the pelvic base and inner thighs as circulation increases. Why 40 seconds? Your connective tissues, the fascia that supports muscles and vessels, respond to sustained gentle pressure held long enough for the nervous system to decide, this is safe. Many people press for 5 seconds and let go, but the tissue simply rebounds to its old state. Around the 30 to 40 second mark, receptors that sense stretch and pressure begin sending a calming message upward, and the pelvic floor responds with a small but meaningful release. That release is what frees blood flow, softens excessive guarding, and rebalances the coordination between your abdominal wall, your diaphragm, and the muscles that support your bladder and bowel. You are not forcing anything. You are negotiating with your own biology in a language it understands: time, warmth, and consistency. What should you feel? And just as important, what should you not feel? Expect gentle warmth, a sense that the surface broadens, or an exhale that comes easier than before. You might also notice your feet feel more grounded and your lower back less tense. What you should not feel is sharp pain, pins and needles, or any sensation that makes you want to immediately pull away. If you feel burning, stinging, or throbbing, stop, reduce the pressure, and try again another day with extra cushioning. Safety first. If you have a current flare of hemorrhoids, an active skin irritation, a fresh surgical site, unexplained bleeding, or a pelvic infection, postpone the technique and speak with your clinician. If you are on blood thinners or have significant osteoporosis and are unsure about pressure tolerance, use only the soft towel method and keep the pressure feather light. Let's practice the routine together once more, this time adding breath counts so you can memorize it. Sit tall, feet grounded, towel under the pelvic center. Inhale for a count of 4, feeling your lower belly expand like an umbrella opening. Exhale for a count of 6, letting your jaw unhook, tongue resting behind the teeth. Begin the 40-second hold now. At second 0, lean a touch forward. At second 10, scan your shoulders and drop them. At second 20, relax the space between the eyebrows. At second 30, picture the pelvic floor as a hammock that yields slightly downward with each exhale. At second 40, release the lean, settle back, and breathe normally. Stand up slowly, roll your hips in a small circle, and notice if your stride feels easier. That entire sequence takes less than a minute, and most people feel a small but distinct change right away. Why is this useful for people over 60? With age, we often accumulate small patterns of bracing around the pelvis from years of sitting, a few falls, surgeries, digestive changes, or simply the habit of tightening when stressed. That bracing can make the pelvic floor overactive, working too hard and too constantly, just as easily as it can become weak. A common misconception is that the pelvic floor always needs strengthening. In many mature bodies, it first needs an invitation to let go to improve its rhythm of contract and release. The 40-second perineal press is a down regulation tool. It tells the system, you can relax now so that later, gentle strength work or walking feels more natural and less effortful. Relaxation and tone are not enemies. They are dance partners, and relaxation usually needs to lead first. There are broader benefits to expect when you practice most days for 2 to 3 weeks. Blood flow in the pelvic region improves as the tiny arteries open and the veins return blood more efficiently. That is often perceived as warmth and comfort while sitting and standing. The diaphragm above and the pelvic floor below begin to coordinate better, so breathing deepens and the abdomen moves more freely. The low back and hips receive a message to share the load more evenly, which can reduce the sense of stiffness when you get up from a chair. The bladder benefits from a calmer neighborhood. Urgency often feels less urgent when surrounding muscles are not clenched all day. Bowels may move more regularly because gentle pressure and breathing stimulate the reflexes that encourage movement. Perhaps most important, you gain a clearer connection with your body at a level that supports confidence. You feel that you can influence comfort with a minute of mindful practice. Let me give you 3 variations so you can choose the one that fits your day. The first is the soft ball sit. Use a very soft inflatable ball, roughly 10 to 12 centimeters across, and deflate it slightly so it yields easily. Place it under the pelvic center, sit tall, and perform the same 40-second lean with breathable pressure. This method is excellent if your hands are arthritic or you want a consistent contact area. The second is the towel triangle. Fold a hand towel into a thick triangle and place the point of the triangle forward. The thickness should feel like a gentle wedge, not a bump. Lean into it for 40 seconds, imagining the tissue melting around the wedge. The third is the standing wall press. This is useful when sitting is uncomfortable. Stand facing a wall, place both hands on it at chest height, step one foot slightly forward, and imagine you are leaning your tailbone backward into a soft cushion behind you. Engage a tiny pelvic rock to direct pressure into the same pelvic center for 40 seconds while you exhale slowly. This standing option reduces chair contact, yet still gives the nervous system the release cue. People often ask, how many rounds should I do in a day? Start with 1 round once per day for the first week, ideally in the evening when you can relax after. If you respond well, less tension, more comfort, add a second round earlier in the day, perhaps after your midday meal or after your short walk. More is not necessarily better. What matters is that each round is calm, comfortable, and consistent. A helpful rhythm for many mature bodies is 40 seconds of pressure, then a full minute of relaxed sitting, then a short, gentle walk around the room. That sequence marries release, rest, and movement, so the change integrates into how you stand and walk. Let's talk about breathing, because breath is the quiet amplifier of every benefit here. Use a longer exhale, then inhale. 4 counts in, 6 counts out, through the nose if possible. On the exhale, silently say the word, soften. The word is not magic, it's a cue that turns down protective guarding. If you feel your abdomen barely moves, place one hand on your lower belly and imagine you are inflating a low, wide belt rather than lifting your chest. If shoulders insist on rising, think of yawning inside your ribs. Soft, slow, inevitable. Breathing like this while applying gentle pressure is what convinces the system that it's safe to let go. What about posture and walking after the press? Stand tall, place your finger pads on the sides of your pelvis, and imagine your hips as the hinge of a friendly door. As you take the first steps, picture that door swinging smoothly. Many people notice that the legs feel a touch lighter, and that the stride becomes more symmetrical. That is not a coincidence. When the pelvic floor stops bracing hard, the hip flexors and deep rotators quit overworking, and the gait organizes itself with less noise. This is one reason the technique pairs beautifully with a 10-minute easy walk after meals. Release first, then move, so the new pattern has a chance to settle in. If you live with a partner or a close friend, consider a supportive version that preserves privacy and consent completely. Sit side by side, each with your own towel setup. Start your 40 seconds at the same time. Breathe together, and then take a slow stroll in the house. The shared rhythm creates connection without any need for explicit conversation. Many couples over 60 report that this kind of parallel practice restores a sense of teamwork and reduces the awkwardness that sometimes builds when each person is coping privately with bodily changes. Connection is often built on shared calm, and calm is trainable. You might wonder whether this technique is different for women and men in the later decades of life. The principle is identical, but the perceived benefits can show up in slightly different ways. Mature women often notice relief from the dragging sense that appears after long sitting, a kinder relationship with the abdominal wall, and a smoother rhythm with bladder cues. Mature men frequently describe less deep seat tension, easier initiation of a urine stream, and more comfortable sitting on firm chairs. In both cases, the mechanism is the same: reduced over-guarding and improved microcirculation at the pelvic base. Keep expectations modest in the first week and pay attention to small wins. They usually arrive first and multiply with repetition. There are a few troubleshooting notes that save frustration. If you feel nothing, your pressure is likely too light, or your attention is scattered. Increase the contact slightly and slow down the exhale. If you feel too much, your cushion is too firm. Add layers or switch to the standing wall version. If you cramp, you are probably holding your breath. Reset and count the out-breath. If the low back aches, Pull the towel half an inch backward or forward to shift contact, or place a small cushion behind your lower back for support. If you become sleepy afterward, that is not unusual. Your parasympathetic system did its job, so schedule the routine when drowsiness is welcome. A 7-day integration plan can help you turn this into a habit. On day 1, do 1 round in the evening and write down 3 words describing how you felt, perhaps warm, grounded, relieved. On day 2, repeat and add a 5-minute easy walk afterward. On day 3, keep the evening round and add a morning body scan for 1 minute where you simply breathe and notice the pelvic base before getting up. On day 4, introduce the standing wall version at midday if you sit for long periods. On day 5, return to the towel triangle and increase your exhale by 1 count, making it 4 in and 7 out. On day 6, invite your partner or a friend to join you, with each person managing their own setup. On day 7, compare your words from day 1 with your experience now. Look for small patterns: fewer bathroom trips at night, less restlessness in the hips, a kinder mood after meals. Those small patterns are the honest measures of progress. Let's also cover when to consult a clinician before you continue. If you have persistent pelvic pain, unexplained changes in bowel or bladder function, fever, new weakness in the legs, or numbness in the saddle area, seek medical evaluation. If you have had recent pelvic surgery, ask your surgeon when gentle seated pressure is appropriate. If you use a pessary or similar device, get personalized guidance on timing and positioning. And if you're unsure whether a sensation is safe, the best approach is to pause the routine and get specific advice. There is no prize for pushing through doubt. There is a quiet, emotional benefit in mastering a skill like this after 60. Many people rediscover a sense of authorship over their body. You are not waiting for comfort to arrive from outside. You are producing comfort with breath and patience. That change in narrative matters. It makes walks more inviting, chairs less intimidating, travel less draining, and moments of closeness more relaxed. Confidence in the body is not grand. It's cumulative. 40 seconds at a time most days is enough to build it. I want to give you one more guided round so your mind and body can memorize the pattern. Sit tall, towel under the center, feet steady. Inhale gently for 4. Exhale for 6 and let your shoulders descend. Begin the lean, just enough to feel contact. At 10 seconds, soften your jaw. At 20 seconds, imagine a warm light the size of your palm at the base of your pelvis. At 30 seconds, allow the floor of the pelvis to yield downward with the exhale as if a hammock is carrying you. At 40 seconds, return to upright, let the breath be natural, and notice the new baseline, subtle but real. Stand, take 3 easy steps, and feel how the body organizes itself with less effort. If you want to deepen the effects, combine this practice with 2 complementary habits over the next month. The first is a 10-minute relaxed walk after your main meal. Movement circulates the benefits from local to global. The second is a simple evening breathing pattern for 3 minutes in bed. Inhale for 4, exhale for 7, no pauses, eyes closed. Those 2 allies, walk and breath, extend the message of release to the whole system and help you sleep more steadily. Better sleep, calmer nerves, smoother gait, easier sitting. These are the quiet ingredients of intimate well-being in the later decades of life. As you move forward, keep your attention on honest signals rather than expectations borrowed from younger years. Your body today communicates clearly when you listen in the right way. If the perineal press leaves you feeling warm, steady, or simply more at home in your chair, that is victory. If on a given day it feels like too much, that is also information. You can return tomorrow with a softer towel, a shorter hold, or a standing version. Flexibility is your friend. The purpose is not to pass a test. The purpose is to restore ease. You now have a practical, discreet technique that respects privacy, requires no equipment beyond a towel, and takes less than a minute. A 40-second perineal press with calm breathing to invite blood flow, reduce guarding, and support pelvic comfort. Try it tonight. Notice what changes over the next week, and let your experience, not theory, guide your commitment. Vitality in the mature years is not about doing more. It's about doing the right small things with consistency and kindness towards yourself. If this routine helps you feel steadier, share it with someone who might benefit, and keep walking, breathing, and practicing. Your body listens, and it answers.